Today, we are excited to present Dr. Latif Murji. Dr. Latif Murji is a family and ER physician based at SCHC. Dr. Murji is the founder of the widely acclaimed Health Facts Clinic, a groundbreaking initiative that addresses vaccine hesitancy through physician-led phone conversations and has now broadened its scope to include cancer screening. His work with Vax Facts Plus has garnered national media attention and serves as a blueprint for engaging communities in health literacy. Dr. Murji is a lecturer at the University of Toronto, where he has created a novel health equity curriculum for resident physicians based on the tenets of experiential and transformative pedagogy. He is the founder of the not for profit organization Stand Up for Health, which delivers immersive learning experiences to train healthcare workers in health equity and advocacy. By night, Dr. Murji showcases his artistic flair as the lead vocalist of the indie alt rock band Parachute Thieves. And without further ado, please help me to welcome Dr. Murji. Dr. Murji, whenever you're ready, you can take the floor.
Hello, hello. Thank you, Lisa, and welcome everyone. Um, today we're going to talk about RSV. So I'm going to try to share my screen and do it in the way that works. All right, let's see here. Share a portion of my screen. I think I think this is it. Hold
That's
on.
perfect. We can see it.
Nice.
It looks good.
Beautiful. All right. So Uh, I'm Dr. Latif Murji. We're going to talk about RSV today, one of my favorite topics. So just so you know, again, I lead the Health Facts Clinic, also known as Vax Facts Plus. We have two names, and this because we give so much facts. So we're going to give you the facts today about RSV. And thank you to SCHC for making this possible and Scarborough Health Network. This is a collaborative initiative that is a unique initiative in this country. And we're really glad to be able to have a clinical service dedicated to counseling patients. So we'll get back into that later. But today we're talking about RSV. So these are the things that you're going to know from today. You're going to know about RSV. You're going to know why it's important. You're going to know who it's most important to protect, and how to protect them, and what to do if you think someone has some red flags, and just understanding the latest guidance in Ontario for the different options we have. So we're not here to make you a virologist, but just to help you feel like you understand what's going on. So what is RSV? RSV is respiratory syncytial virus. So it's kind of like the common cold, except that it's worse. Otherwise, we wouldn't be talking about it. So it's spread by droplets and direct contact, which is similar to cold and flu. And the season is similar as well to the flu season. So we say it starts in November approximately until April in Ontario. And for most healthy people, they experience it as a mild cold. But for certain populations, which are infants, older adults, people who are immunocompromised or who have chronic conditions, this can be serious disease, causing things like pneumonia, bronchiolitis, these kinds of things, which would cause hospitalization and other problems. So we want to prevent this. Prevention is the best is the best thing you can do. Okay, so we just discussed who is at highest risk. Who are we trying to protect? So we have our infants, less than 6 months, especially premature infants, because their immune systems are very immature. Children who are less than two who have other conditions, so they're still considered high risk. Whereas an infant who is, let's say, 1.5, who's healthy, is no longer considered high risk. Uh, Adults who are 75 plus, you'll find out soon they are already like automatically covered starting this year. And if you're from 60 to 74 with a chronic condition, which is, pretty common in that age group, then you're also considered high risk. And then pregnant people, we know that they are high risk for all kinds of infections due to the way that their immune system changes during pregnancy and that they have less respiratory reserve and that they have a baby inside them, or maybe two or more. And then people who are living in crowded settings. So multi-generational homes, long-term care, shelters. Crowded settings means more transmission of infection. So these are the people that we want to protect the most. It's very important that we identify them and get them a form of immunization. So, what does RSV look like in an infant? So, it starts off with these typical non-specific viral symptoms like a runny nose, maybe a bit of a fever, a bit of coughing. Then it goes to wheezing, and then you have difficulty with breathing, so they're breathing more rapidly. Feeding might decrease, which means that output, so like the wet diapers decrease. Once that starts happening, now we're starting to get a bit worried, right? So we're looking for any red flags, such as the way the baby's breathing, if it's changing, if we're noticing a lot of indrawing in the chest wall muscles and their bellies flaring out when they're breathing, or if the baby stops breathing for a period of time. And as I mentioned, if we're having much less wet diapers, that means that the baby's dehydrated. And when we say lethargy in a baby, it means like a very serious decrease in energy from the baby where they're like moving very little because they're just totally exhausted. These are the signs to come in now if you're a parent. And hopefully you would identify it before this happens. And then what RSV could look like in an adult is, again, start off with these non-specific symptoms that look like a common cold, just like a cough, runny nose. And then it starts getting worse, right? So you could have some more significant fatigue, which again resembles like the flu. Um, and then it can trigger flare-ups of common conditions that are serious, right? Like COPD, heart failure, and then you get vulnerable to more serious disease. So we can think of pneumonias. We would be admitting people if they have serious infections. So this is what it could look like. This is how it could progress. So it's the most important thing we can do. I'm going to tell you this a million times is prevent it and before anything happens. But then we still want to know if it's happening because then we can treat it. Okay, so how it spreads. So similar to a cold or flu, these are respiratory viruses that spread through coughing and sneezing. So droplets, also contaminated surfaces. If you're touching them and touching your face, that's how it can get to you. Um, the virus survives for hours on different surfaces. So what this makes it kind of obvious, and I'm sure you've heard this a million times, is wash your hands regularly, frequently, and well. So use soap, use a proper hand washing technique, get in all the crevices, really wash them effectively, thoroughly, and frequently, because that's how you decontaminate your hands, and your hands are going to be like one of the most common ways to spread these types of viruses. And you have an incubation period for 4 to 6 days where you might not have any symptoms, but the virus is already in you. And then you are infectious for 3 to 8 days where you're actually, contagious. So just think about, we want to prevent this. Even if you have it, we still want to prevent it, right? First of all, we want to prevent it with vaccination and proper precautions. But once you have it, we still want to prevent the transmission of it through hand washing and wearing a mask if you're coughing, staying home if you're sick. We want to clean like toys high touch areas, just having good routine practices, especially in a healthcare setting, is really important. Okay, so now my favorite part is the part about immunizations. So these are the different ways we can stop RSV in its tracks. We have our options for infants, which is basically a monoclonal antibody called Beyfortus. Nirsevimab is the generic name, but it kind of goes by the name by Beyfortus, despite the brand name not being preferred. We all just use it. So you'll hear this name, Beyfortus. This is an immunization, okay? Um, I will get into the difference between immunization and vaccine, but these are very similar terms, and you will shortly learn the exact difference. But also, there's options for pregnant people, which the point of this is to protect the baby, okay? So this is a Abrezvo, which is a vaccine. Then there's vaccination options for older adults. There's three different options. Uh, so one of them is a Abrezvo, which is the pregnant vaccine. Another one is RXV. Another one is the mRNA virus that, sorry, the mRNA vaccine that Moderna just put out. Um, but they're all vaccines. They all work. Um, so essentially, it doesn't matter which one you get. So think of it as Coke and Pepsi and President's Choice Cola. Um, So as we mentioned, the season, it's the fall, right? So we want to, there's a reason why I'm giving this presentation right now, because this is when we want to protect our population. So we don't want to wait halfway through the season to start vaccinating. We want to do this now. So let's get into it. Okay, so what's the difference between a immunization and a vaccine? Well, a vaccine is when you are giving the patient something that will stimulate their immune system to then produce antibodies. So they're making active immunity, right? They're working to make their own antibodies. And immunization is just when someone receives antibodies. They could make it themselves, or they could just receive it from an external source. So it's an umbrella term. A vaccine is a type of immunization. It's the most common type of immunization because typically we like to make our own antibodies, or we prefer it for the patient to make their own antibodies. However, in the case of Beyfortus, this is not a vaccine; it's an immunization. So it is the type of immunization that does not involve the production of antibodies by the patient, which means we are directly giving the baby the antibodies. They are not making it themselves. Okay, so we're giving monoclonal antibodies to the baby. Now they have the antibodies that otherwise they would have made, but they're just not able to make it at this young age. And so they just have protection from the antibodies. And it actually works quite well. And it lasts around 5 or 6 months. And it's funded in Ontario for babies who are born this year since April 1st. So this is going to be their first RSV season coming up right now. So by definition, they would be younger than 8 months right now. And if anyone is born during the RSV season, then they will automatically be eligible for this, and the hospital will give this. It's also the other group that's eligible for this is babies that are less than 2 years old who are high risk. So it's either babies entering their first RSV season, like all across the board, doesn't matter if they're high risk or not, just because of their age makes them eligible. And then if it's their second time around and they're over a year old, then it's only if they're high risk. And you can give other vaccines at the same time as this. And I will say that, and that's what applies for every vaccine. Okay, so now this is the other option to protect babies is you give mom the vaccine while the mom is pregnant between 32 and 36 weeks gestation. So in this case, the mom is creating the antibodies because it's a vaccine. So there's active immunity happening. She's creating her own antibodies, and then they go through the placenta, and then the baby has the antibodies and the baby has the immunity. So in a way, from the baby's perspective, It's the exact same thing. The baby is both times with this vaccine and with Beyfortus, the baby is getting passive immunity. The baby is not doing any work. Their immune system is not working in either situation. So essentially, we would think the outcome would be the same, right? Well, it turns out Beyfortus is slightly better, okay? But the important thing is to know that both of these options are way better than not doing it because both of these options give great protection against RSV for the baby and and they're both safe. So this is something that we support doing. And if you really want to get into the details, there was a study last year that showed that Beyfortus is ever so slightly more effective at preventing RSV severe complications in babies. So might as well go for that one. But there's nothing wrong with getting the maternal vaccine at 32 to 36 weeks. And that is also publicly funded by the Ontario government. Okay, so now there's these vaccines for older adults. And as I mentioned, there's three of them. And it doesn't matter which one you get. This is now the Ontario funding has opened up public funding so that any adult who is 75 years or older is eligible for a vaccine. And if they got it last year, they should not get it this year. You don't need a booster dose of this yet. This is all just a couple years old, so there's not enough evidence to know how long the immunity is going to last. So maybe in the future that will change. However, right now, you just need one lifetime dose as of now. Um, so anyone who's 75 and up should get the RSV vaccine if they haven't yet. Also, if you're 60 to 74 and you have a chronic condition such as COPD, CHF, immunocompromised, or you're living in a situation that makes you high risk, you are also eligible for public funding. There's other options. If you're 50 plus and less than 60, you could get it through private pay if you wanted to. But it's not necessarily um, highly recommended because the higher you go in age, the more important it is to be protected against RSV. Okay, and then people always ask, is it safe to get with the other vaccines like flu or COVID vaccines? And yes, you could get them all on the same day, theoretically. It's better to put in different arms, but even, three of them, you could put two of them in the same arm. It's not the end of the world. Separate it by a couple inches at least, just so that you know which is going where in case there's a localized reaction, something like that. But again, these side effects are very mild. They're not very common. Um, so these are safe. And of course, the risk of any side effects is much less than the risk of disease if you don't get vaccinated. So we always encourage vaccination for these populations that would benefit from it. And for the flu, that's everyone. Everyone should get their flu vaccine. Um, so the co-administration, yes, that's the bottom line there. All right, let's continue along. So as I just mentioned, side effects and safety, things that you might get are sore arm, fatigue, headache, maybe a little bit of a fever, maybe a little bit of nausea. These are often mild and they are reversible. Usually with Tylenol helps manage the symptoms relatively quickly. Allergic reactions are super rare, and that's why we keep you and monitor you for 30 minutes because even if it did happen, then we'd be able to treat the patient, so it's not a problem. Um, Unless you already know you're specifically allergic to something within a vaccine. And then you should talk to a physician about that. But overwhelmingly, these are very safe. There's no reason to be concerned about the safety of these vaccines. They're extremely safe and well researched, and Health Canada has approved their safety after a lot of testing and data has been produced. They're safe in pregnancy, they're safe for babies as well. And RSV, not safe. So that's your options, right? So, testing for RSV. So what if you think someone's actually infected with this virus. Okay, so the way we test for this is through a nasopharyngeal swab. Remember for COVID, we used to do these? So there's like a respiratory panel swab that often can test for RSV and COVID and influenza all at once. So that can be done. Um, but we don't just test everyone willy-nilly. It's not, uh, the reason for testing is if it's going to change what we're going to do in terms of management. Okay. So if you're deciding whether this patient needs admission, if they're very sick, if they're a high risk person, like in a high risk group with other comorbid conditions, those are reasons to be testing. If you're in a place that you might be having an outbreak, then we want to identify if it's the same thing going around. So those are the reasons to test. In terms of surveillance, we're not testing for the purpose of surveillance. We're testing for the purpose of managing the patient in front of us. The surveillance is done by Public Health Ontario. So they actually have like a dashboard on their website that they're going to be showing the positivity rate and how many people are getting sick with RSV. They do the same thing with flu and COVID positivity as well. So this is how we monitor what's going on population wise. Okay, and then the treatment. So the treatment for RSV is mostly supportive care. So what that means is rest, fluids, and Tylenol or Advil as needed for symptoms. Um, we do not need antivirals. This is an outpatient setting that we're talking, about right now. Um, you can do some gentle nasal suction in an infant if needed with saline. But if you're seeing that there's desaturation, their oxygen level on the SAT is lower than 92, yes, they should be seen in the ER. Okay. If their feeding and output, the wet diapers is dramatically decreased, those are signs of dehydration. Other signs of dehydration, such as mucous membranes being dry or sunken fontanelle for a baby. These kinds of signs, if you notice the baby's dehydrated, they should be seen in a more acute care setting, or any signs of respiratory distress as well, which we also discussed. So this is all for treatment, but remember, the real thing that we care about is prevention. We wouldn't have to worry about this stuff if we can prevent this, and we have immunizations for this. Okay, so as I mentioned again, just so you know, red flags is if the baby is not taking in orally or they're not breathing, right? There's big pauses in their breathing, or they're breathing super fast and they're working super hard to breathe. You can see that their chest is retracting. They're using accessory muscles in their chest and their abdomen to help breathe. They have a fever, and they're less than 3 months old. Um, and then for older adults, similarly, any respiratory distress, signs of respiratory distress or decreased oxygen saturations, these are reasons for them to be seen in an acute care setting. So common questions you'll get that we hopefully have already answered, but just to reiterate, is RSV just a cold? No, it's not. It is mild for adults usually, but dangerous for babies and seniors. Is the vaccine safe? Absolutely super safe. Is it effective? Yes, also. Do I need it every year? No. We are awaiting more guidance on that, but as of this year, you do not need it every year. And let's see what the evidence shows over time. Can I get RSV vaccine with the flu vaccine or COVID vaccine? Yes, you can. Do babies need both? Do they need the RSV vaccine from their mom and then before this when they're born? No. You can, if you're a pregnant mom, you can choose which way you want to go about it. So the key takeaways: RSV, very common. Now we have a way to prevent it. We're lucky it's 2025. There's a lot of crazy things happening right now. one of the great things is this. This is a positive. So something to get excited about. We have a way to prevent RSV, which did not exist years ago. Um, and not only do we have something that exists, our government is paying for it. Okay, so it's actually worth paying for because it's that effective of a public health intervention, and it's that safe that we can give it to everyone who qualifies. Um, and the care for people who are infected is still supportive care. We're just, Tylenol for symptoms, but it's just rest and fluids. And you are important because this is all about people understanding. It's all about prevention, which relies on health literacy, which is the reason why we're doing this. So it's really important that we all understand how this infection, affects people and who it affects and how everything works so that we can prevent this and work well in population health uh, situation. So Facts Plus is health facts. This is a clinical service. You can speak to a physician one-on-one on the phone, ask any questions. That's the link. I'm sure you know this well by now. So please continue to share that. And thank you very much for being here. And if you have questions now, we can talk about them here. And again, if you'd rather talk about it in an appointment, or if it has to do with your medical conditions or your medications or something to do with a patient, we should probably do that in an appointment. But I'm here now to take your questions. Thank you. I guess I should stop sharing my screen now.
Thank you, Dr. Latif, for that amazing presentation. I mean, you said it. You're okay with questions, so I think that's what we'll move to. While you were giving a very informative presentation, there were some questions that popped up in the chat, and some were answered throughout the presentation. But I did just want to highlight one of the questions was from Romina around if babies need the vaccine and the immunization, so both once to the pregnant mom and then once when baby was born. And yourself and Lena both answered not both, one or the other. I just came back from mat leave, so I remember asking this very question as well. So the other question was from Hillary around accessing these slides from your presentation. We are going to have this session available because it is recorded, but do you provide the slides that you just shared?
Sure. Yeah. Like the whole recording will be available on YouTube.
Yeah.
Yeah.
Wonderful. Thank you. And it's very helpful for, down the road when folks have questions, they're like, yeah, I remember Dr. Murji said something about that. So having it accessible even after is going to be helpful. And Hillary also asked, can you discuss spacing with the flu vaccine if it's not given on the same day?
Yeah. So you don't need to space it at all. So you can give it on the same day. If you don't, then you can give it on the next day or the next day. There is no spacing issue whatsoever.
Wonderful. Hillary says, thank you. Um, so I'm just opening up the floor to folks if you'd like to ask a question. The chat box is still there if you prefer to type it in.
I also want to just add, like regarding this co-administration, which means giving it on the same day, like I would recommend that you do this. Like it's better to give it on the same day than to space it out by 1 or 2 days, or a week or 2 weeks, because then your immune system is just getting activated all at once. Um, there's nothing wrong with that, and very importantly, um, you don't have to get people to come back in, and you're gonna lose people every time. Like there 100% that you will lose some percent that is, uh like you're not going to get 100% rate of people coming back. So why make them come back. It's a waste of everyone's time, and you're just gonna not vaccinate everyone. So just while you have them, get them all done. That's the best way to do it.
That's helpful. Thank you. We have a question from Mercedes. I got the flu vaccine last Friday. Good for you, Mercedes. And I remember that in the consent form, it asked if I have the RSV in the last 15 days. Do you know why this question is there?
Someone has already answered this.
Oh, Lena's fast. This may be more of an opera. Oh, no, this is another question.
Oh, okay, okay. Yeah, I don't know. Did they ask Mercedes, did they ask if you've had the RSV vaccine in the
Yeah.
yeah? Okay.
Yes. So so and after I was supporting a clinic Sunday, so many people was asking me what did that mean because I wasn't, so didn't know. And so I said, oh, what they asked. So this is what I'm curious about. So if people ask, oh, I can have a more
Mhm.
explanation for that.
Well, I don't know like who made the consent form.
No clue.
Yeah. Right. So
Maybe the nurses know, or maybe, I don't
yeah,
know.
it's just
This
like a local consent form that someone just made in SCHC. Everyone uses different consent forms, so I don't know why they would ask that question. Um, I don't know.
Okay.
What I can tell you, it's safe to take them both at the same time.
Okay, perfect. This is the most important information. Thank you.
No problem.
So just from, I'm going to get to your question,
Oh,
Lena, and thank you, Mercedes, for your question. Cheryl, is one of the nurses, has said it is our CC consent form for our flu clinic. And then Hillary had said our own SCHC RN medical directive says that flu shot should not be given if RSV vaccine was given in the last 15 days. Should we change this?
Yeah, maybe we should change this. So this is let's talk about that offline.
Yeah,
As probably it should be changed. But maybe there's something that I don't know, a reason why that exists. Maybe it's just from a previous year where we didn't have this guidance. But now that we do have this guidance, unless there's another factor logistically that I don't know about, we probably should change that because, as I said, we want to get as many vaccines done as possible safely as we can in one visit. So we should not create barriers to that in our own policies that are not medically necessary.
wonderful. And we'll definitely take it offline. I just made a note. And I think that's why it's helpful to have these conversations because the more you know, the better that you can do to increase access, like you said. So just going back to Lena's question, this may be more of an operational question. Is the vaccine for pregnant women being supplied at the obstetric office or the GP office?
Yeah, good question. So I don't know 100% the answer to this, but from my understanding, it's both. Like all physicians have access to obtaining these vaccines, and it's just a matter of them ordering it from public health. And they like a lot of I know that both of them do order it. I know some obstetrics physicians that order these vaccines and give them, and I know some family doctors who order these vaccines and give them. So it's just a matter of if it's your obstetrician or family doctor that has them, right? So they both can give them, it's just an individual basis. There could be some obstetricians or family doctors that are like, "Oh, I don't do this." That's possible. Um, should they be doing it? That's not my place to say. Like, it depends on their patient population. Maybe if you're a family doctor and all your patients are like elderly and or yeah, you have no pregnant patients, and then you're like, okay, I leave this to obstetricians, then I guess that, it's a personal thing in that way of how they want to manage their practice. So I would ask, like, if you're a pregnant woman, I would encourage you to ask your family doctor, like, do you have this in stock? Because I want to get this. And then if the answer is no, then they can get it from their obstetrician, or they could ask vice versa. The point is just communicate with your provider because either of them could have it or both could have it. Um, But remember, there's always Beyfortus. So if you're pregnant and you don't get the RSV vaccine, that's okay, as long as you know that when the baby's born, it is definitely advisable to give them Beyfortus, which is the monoclonal antibody. And if the baby's born in November, I believe, is probably around right when it will start, they will just be able to get it in the hospital rather than going back to their family doctor or pediatrician for the shot.
Wonderful. Thank you. Just scrolling up a little bit here. Vanita has a question. Will midwives be giving them?
I do not know the answer to that.
Yeah. Anecdotally, I had a midwife and they had sent me to my family doctor for mine, but I don't know if that's the same for everyone. So I just want to echo Dr. Murji with, asking because you never know unless you ask.
Mhm.
Then we had just a comment from Fenny. Maybe for nurses, we need to have the medical directive change before we proceed when we're doing outreach. Unless we get an order from the PCPs, we are bound to the medical directive unless changed. And that's absolutely correct. And I think that's why we need to have other conversations around those directives and those policies. Sometimes policies can reduce or increase barriers, right? So that's
Mhm.
helpful.
Yeah.
Any other questions? Feel free to put up your hand, and when we get to you, you can unmute yourself. Or again, if it's more comfortable in the chat, it seems like we're having a chat question vibe going here, which is absolutely fine. Feel free to go ahead. Mercedes says, I remembered when I gave a presentation to a group of pregnant moms, they did not know about the RSV vaccines and their doctors did not mention it. So more of a
Yeah,
comment.
yeah,
Yeah.
yeah. It was at that moment everything was very new, so I didn't know what to say at the moment. And I say, "Well, maybe you need to talk," and that now you knew about this vaccine, so this is a conversation that you need to have with your doctor. Yeah,
Yeah, this is a good point. I'm glad Mercedes brought it up. A lot of people, especially pregnant people, but who's to say even older adults, like people just don't know about RSV, and they don't know how like we have a prevention, like we have a vaccine for this now, right? So that's why it's so important to just talk about this. Like our job here is to elevate the health literacy in our community, and at the very least, just having these conversations, even if someone's not pregnant, right? Like let's say you're just talking to a woman who is of childbearing age, as we say in medicine. Um, like just them knowing that it's a thing, like that RSV exists and that there's a treatment for this, them having that knowledge is empowering them. Who knows? Maybe they're going to talk to their sister or their cousin, or maybe later when they're pregnant, then they'll be like, yeah, wasn't there another thing like RSV? It's just good. And or it will prime them so that maybe next time they'll notice, maybe there'll be an ad on the bus and they'll just remember, they'll connect the dots from what you told them, and then now they're like starting to learn, right? So these conversations are important to have with everyone, even like a healthy young adult. Like them knowing is going to make them want to make sure that their parents are vaccinated. So just having these conversations, very important. This is a new topic. This is a new prevention method. These vaccines are new in the past few years. They've just become opened up in terms of eligibility and like funding coverage for everyone who's over 75 years old. So a lot of people had barriers to access it before, especially our community in Scarborough. So it's really important that everyone's hands are on deck in terms of just getting the word out there. Get your RSV vaccine. It's very safe and very effective. So let's get people vaccinated.
Great. So from Amy, my aunt is over 75. She asked her family doctor for the RSV vaccine. The doctor said that she did not need to have this. What would you recommend?
Well, so yeah, okay. So okay, let's start here. I don't know the whole context here, right? Probably there was more of a conversation happening, but Obviously the patient would benefit from the vaccine, right? Whether the quote is you don't need to have something like I don't need to eat vegetables, but I would be much healthier if I did rather than eating McDonald's. So, nothing is black and white, right? So, uh, there's a benefit and risk to everything. When someone is over 75, the benefit is much, much, much greater than the risk. So, it is recommended that every single person who is over 75 should get the vaccine. Whether they need to, that is like a semantic question. Um, but they should get it if they want to lower the risk of an infection that is dangerous. So yes, uh, they should get the vaccine.
Perfect. I hope that answers the question for you, Amy. And along those lines, I know working in community health, one of the top questions is, what if this person or what if this family, what if they don't have OHIP?
Oh, what if they don't have OHIP? Great question. Um, I actually don't know for sure if it's covered if you don't have OHIP. Can someone double check that right now? I can also double check it real quick.
I
Thank you.
think the post that I saw today in the Toronto Public Health that I shared in the chat is for, say, for people that doesn't have a GP. So assume that is covered, is a free for people that doesn't have a OHIP. Like I wanna double check today. I saw the post and I share with you guys there that Toronto Public Health are doing a clinic in one of the center in North York.
Yeah, I think that you can get it without OHIP. Like I'm seeing in Toronto Public Health, it seems to indicate this.
That's good news.
Yeah. So,
Sorry to interrupt. From what I'm seeing is that you can pay for it if you don't have OHIP, but to get it publicly funded, you probably will need OHIP.
okay. Where are you seeing that?
Wh-
Um,
What do you
that
say, Philip? I didn't understand what you mentioned. Sorry.
this one it is part of sorry, I'm trying to find it now. It's in the city of Toronto, the RSV thing. Let me try to find it. Unfortunately, it's like how Google works now. It shows you the stupid AI version first, so I have to go and find the source. But
For my understanding is everything what this Toronto Public Health, you don't need OHIP, you don't need any status. It's like the catch-up vaccines, the flu. You don't need anything. Of course, you don't need to pay, but maybe I can be wrong. And also confirm this post that I saw today that I share with you guys that say COVID flu vaccine also we available. You can get them at the same time in the same promotion that the RSP.
yeah, I'm gonna just say ignore what the hell I said because I'm reading it more and it's just being very confusing. It's not saying anything
The,
directly. So I think yeah, like it should be okay.
Yeah, that's okay, Philip. Thank you. Any final words on that, Dr. Murji?
Yeah. Thanks, Philip. So I'm even getting like kind of gray zone type of answers from my searches. Again, coverage is not my expertise. Um, I can tell you that it's medically, helpful to have this vaccine. Whether someone in who doesn't have OHIP, like what I'm seeing is if you are considered an Ontario resident, then you are covered.
Okay.
But also, I'm not the expert at this, but if you're considered an Ontario resident, then you are eligible for OHIP. So it's kind of like that. So from what I understand, what you said, Philip, is correct that you cannot get this vaccine for free if you do not have OHIP because that would make you not an Ontario resident. But
Okay.
again, if we have a social worker or someone who knows this better, I think that would be the right person to answer this question.
I think last year, at least, this is before the new recommendations for 75 and older came out. Last year, the babies were getting them, whether they were Canadians, if they had OHIP or not. So I think that part will probably continue. Now, I don't know whether or not if the new eligibility for the 75 years and older is under that or not piece, that they will, if you don't have OHIP, will you still get it? Maybe that's where the confusion is lying in this. So we could maybe find out about that and let you know, I guess.
This is Amy. I just use the the link that Mercedes sent out for the public health vaccine clinic, which gave out flu shot, COVID vaccine, and also the RSV. It looks like that when I go in and it does not ask for a health card when you do the booking. I know at the time when we do a lot of COVID vaccine, public health administered without asking people for a health card. They might need to have a number for that for them to do the Ontario-wide registration, but not the health card, I think. So if they're doing vaccine in the same clinic, I would assume that the RSV probably will be, you can get it without health card, I would assume.
Another
Thank you.
way, we just try it.
I'm
Yeah.
gonna call, this one I'm gonna do it later. And also one thing, doctor, when you mean that, or if you have OHIP, mean that you are Ontario resident, but you know that we work with a lot of residents in Ontario that they don't have they have a precarious status. So they don't have OHIP, but they are Ontario residents. And nowadays on us, what is the status or why you don't have OHIP? Because Toronto is a sanctuary city. So yeah, I'm gonna call. I like to call and go to right to the source, because sometimes, especially we given information, we need to give the accurate information.
Yes.
Thank you.
Please share that with the rest of us.
Yes, our team can definitely disseminate some information once we're clear. I did want to point out that Fenny said that RSV for non-OHIP can only be accessed through TPH vaccine clinics. So we'll get some information and make sure that everybody that joined today has access to that. I just want to be mindful of time, and I want to note that there will always be questions, and we appreciate all of the interest in today's topic, but we do want to respect the deadline of time for folks. Ruthie will put her email in the chat. You also have my email. If you don't, just type in L Hughes and you'll see it in your inbox, and you can always forward questions to us. Dr. Murji, I did want to give you a huge thank you again for taking the time out of your very busy day to present such valuable information and much needed information to our providers today. I mean, this is not the end, right? We'll have you back, and I know you're giving a similar presentation to community, and there might be similar questions. Probably the OHIP question will come up as well. For folks that have joined us, thank you again for joining. Your feedback is appreciated so that we can continue to give these types of webinars and education. If you are interested in entering the gift card draw, please fill out our MS form for the feedback. The link will be shared in the chat. And with that, I hope everyone has a great rest of the day.
Thank you.
Thank you.
Go Blue Jays.
Go
Go Jays.
Blue
Thank you.
Jays.
Go Blue Jays.
The Bluebird. Bye.
Bye, guys.
Bye, everyone. Take care.